Pathogenic Microbiology Laboratory Safety. Here are your objectives for this lecture. Hello. So to start, we're going to do a slight introduction and just a little bit of nomenclature so we kind of are all on the same page as far as these terms when they get thrown out there. So first we have nosocomial. Now that oftentimes refers to something that's a hospital-acquired infection. So sometimes you may see it abbreviated as HAI. Pathogens are a disease-causing organism, so anything that can cause disease. So things that we think of off the top of our head usually, HIV, hepatitis B, TB, which is tuberculosis. And then you have personal protective equipment, or PPE, and that would be anything that is there to protect you as the laboratorian. So your gloves, lab coats, face shields, things like that. Sterilization. When we sterilize items, we remove or destruct pathogenic organisms. Typically in the clinical lab, this is done through the use of an autoclave. The autoclave uses moist heat under pressure to denature the proteins. And then once the proteins are denatured, then the organisms are no longer viable. So I would know these numbers for the autoclave. Basically, it needs to be set at 15 psi, so the pressure, at 121 degrees Celsius for 15 minutes. For quality control, or QC, your autoclave needs to have this done as well. The procedure is that it's usually a little paper strip that's been impregnated with Bacillus sterile thermophilus, and there should be a color change if your autoclave has reached the given parameters. And those parameters are 15 psi, 121 degrees Celsius for about 15 minutes. I've also included a short video on the slide if you'd like to kind of see firsthand a little bit about how it actually works. Legislative and regulatory controls. So you have the Centers for Disease Control, or CDC. They developed the standard precautions back in 1987, and basically what that states is that you treat everything as if it were infectious. And then you have Nuclear Regulatory Commission, or NRC, that regulates radioactive waste. Typically we don't have too much of that in the clinical lab setting. And then we have the National Fire Protection Association, NFPA, and they have a severity rating of 0 to 4, with 4 being the most extreme. So as you can see on the slide, I have a picture there that kind of shows you what that has looked like, and you have probably seen this around as well. But it just gives you a brief, quick snapshot, basically, of some of the health hazards, or if it's reactive, fire hazard, things like that. So the colors on the diamond, blue is health. So if you look at the health section on there, it says, 0 is just basically normal material. It's not really going to do anything to you. And then go all the way up to number 4, and that's deadly. And then you have your red, which is a fire hazard, yellow, which is reactivity, and then you have white, which is like a special notice type thing. So if you can look on the slide and it says, maybe it's a corrosive type material. So kind of a nice little snapshot just to be able to see without having to go in and read the whole SDS or something like that. Also, as far as regulatory controls within the lab, we have the National Committee for Clinical Laboratory Standards, or NCCLS. This organization will set regulations for good laboratory practice. And then we also have OSHA, or the Occupational Safety and Health Administration, which I'm sure you guys have heard of, but they are actually the entity that will regulate the bloodborne pathogen standard. Infection control in the lab is very important, as I'm sure you all know. But with standard precautions, we consider all blood and bodily fluids potentially infectious, like we mentioned earlier. So when we're working with items in the lab, we always will don and doff the appropriate PPE, gloves, and gown. Those ones are almost always given. Sometimes they'll be given goggles or face shields too. It just kind of really depends on what you're working with. You also need to make sure that you are utilizing your sharps containers and only putting sharps in those containers, because that's what they're meant for, right? And then also making sure that you're diligent with your hand washing technique, making sure that you're washing for a minimum of 20 seconds with warm soapy water, and making sure to pay particular attention to the webs of your fingers, around your finger beds, nail beds, and your wrist as well. And then hepatitis B vaccine, that is usually mandated for healthcare workers. For standard precautions in the lab, generally there is no eating, drinking, smoking, applying cosmetics. Don't insert or remove your contact lenses if you wear them. Don't bite your nails, chew on pens, and no mouth pipetting. Gross, right? So there's a picture in the corner there that shows someone before they knew any better using their mouth for the pipette instead of a bulb. So just don't do that. And then making sure to limit the access of the lab to only essential people who actually need to be in there is for the safety of you and patients and visitors in the hospital. And then make sure to assume, again, that all patients are infectious to bloodborne pathogens. Biologic safety levels, we have BSL 1 through 4, 1 being the lowest risk up to number 4, which would be the highest. So BSL level 1 is used when it's an agent of no known or minimal potential risk. So there's really no additional precautions that are needed when working with this type of organism. BSL level 2 are agents of moderate risk. These are common agents of infectious disease. These would be things that we commonly work with in the microbiology lab, so things like E. coli, streptococcus, staphylococcus, those types of organisms. BSL level 3 are agents with respiratory transmissions, so generally I think of tuberculosis when I hear respiratory, and these may cause potentially serious lethal infections. And then BSL level 4 is typically not something that you will see in a routine clinical lab. This is going to be something that has a heightened security. You're going to have heightened PPE. So think of those lab workers in the big spacesuit looking things. The protocols are also going to be different as well for these. These are usually exotic agents that are life-threatening, potentially transmitted the aerosol route, where there is no vaccine available. So these would be an example of Ebola, Marburg virus, things like that. Safe lab environment. So what do we need to consider specifically within microbiology for a safe lab environment? We have elements that need to exist for an infection to occur. So for that to happen, you have to have a host. You have to have an infectious agent. You have to have a certain concentration of that agent, and you have to have a route of transmission for it. The transmission routes can be, you got to think, is it ingestion? Is it through inhalation? Is it caught by a needle stick? Is it entry into non-intact skin? Those types of things. So think about aerosols can be ingested, inoculation, mucous membranes, as well as arthropod vectors. Typically, we will still make up a 1 to 10 dilution of regular household bleach. You're basically going to wipe down your counters before and after you work. If you have a spill or you know that the protocol has been broken, then there does need to be an incident report followed up and completed, and just making sure you're following your facility's guidelines. Also in the laboratory, make sure that you review the exposure control plan for your facility. Make sure that you understand the specimen collection requirements. And then some laboratories will have a HEPA filter that have been placed in their biohazard hoods for extra protection. Personal safety. So understanding routes of transmission is important for you in the microbiology lab, as well as if you are a patient or going to the floor or you're a visitor. It's really just good to know. So the routes of transmission generally are your contact, vehicle, airborne, and vector. Contact is spread of pathogens through direct physical contact, such as touching, hugging, kissing. Contact can also be indirect. So if you think like somebody who is ill touches the counter and then you come up behind them and also touch that counter and it's contaminated, now you may also be infected. Vehicle, this is a spread of pathogens through contaminated food, water, or objects. Airborne, spread of pathogens through tiny aerosol particles that travel through the air. And then you have vector-borne, which is the spread of pathogens from an infected animal to another animal or a human by an insect such as flea, tick, or mosquito.